Hello, my name is Katrina Strepa, and today I would like to go over personal protective equipment for special responses. Today our main topic is probably going to be Ebola, since it was a big deal in the past several months or last year. National Registered Paramedic, bachelor's in biology, and I'm currently a special operations lieutenant for an EMS service. So let's first start by talking, what is PPE? PPE is personal protective equipment, and it refers to protective clothing, helmets, goggles, or other garments or equipment designed to protect the wearer's body from injury or infection. This is from OSHA. The hazards addressed by personal protective equipment include physical, electrical, heat, chemicals, biohazard, and airborne particulate matter. The purpose of personal protective equipment is to reduce the wearer to exposure and to hazards. The clothing creates a barrier between the wearer and whatever the exposure may be. So, why do we need PPE? Well, for one, OSHA says so, which is Occupational Safety and Health Act. OSHA of 1973, which was enacted by the United States Congress. The purpose of this legislation was to develop workplace safety standards. The act resulted in the creation of the Occupational Safety and Health Administration, known as OSHA, and a companion organization dedicated to research, the National Institute of Occupational Safety and Health, NIOSH. These two entities describe in detail what is expected of different agencies when dealing with hazardous materials. PPE will help to keep responders non-contaminated, whether this contamination is blood, body fluids, or any other hazardous materials. So, when do you think that you should wear PPE? Whenever you feel the need arises. You are the first person that needs to be protected, followed by your partner. If you are not kept safe from the surroundings, then you are not good to anyone. It will take you several minutes to put on your PPE if you are needed to fully dress out. But this will be time well spent. Again, protect yourself first. Okay, now we will go over a few situations when PPE should be utilized. In everyday practice, we use PPE. Generally, this consists of clothing, which we are always wearing. Our clothing is normally a level C protection. It will protect you from small, non-penetrating spills and splashes. Then, when responding to medical calls, we always put on gloves, or at least you better, in which to protect your hands from fluids. This is general practice that has become forefront in EMS safety. Furthermore, when we feel that our patients may have a cold or virus that is contagious, some of us sometimes will use a mask, whether it's an N95 or just a surgical mask. A simple N95 mask will protect you from airborne illnesses such as tuberculosis, etc. I'll show you an N95 mask in a few minutes. Let's not forget about radiation. It is also possible that you come in contact with a patient that has been exposed to a dose of radiation, especially here in the coastal region with Sunny Point and places like General Electric. These facilities have been extensively trained in radiation and will be aware of what protection is needed for the spill that they have incurred. Generally speaking, a Tyvek suit will protect you from general exposure. However, please be sure to use your emergency response guidebook whenever responding. When responding to patients that were possibly involved in a chemical spill, again, you will utilize your hazmat team and your emergency response guidebook to determine what equipment and what clothing may be needed to protect yourself. And furthermore, highly contagious diseases. As we all know, in the last year, the United States has had quite a scare with Ebola, maybe making its way into the States. Instantly, a response was put in place to be able to determine if the patients may be contaminated, and when that was determined that it was possible, severe actions were taken to protect everyone around them. So the CDC puts out information every year because they deal with the contagious diseases and they do research. So they have found these following diseases to be highly contagious. Tuberculosis. The CDC actually helped to reduce the number of cases in tuberculosis in the U.S. from 25,103 in 1993 to 11,198 in 2002. Also, the flu. They identified in the 2009 H1N1 virus and created a vaccine for that. So they're saying that they help prevent 5 to 10 million infections, 150,000 hospitalizations, and 1,500 deaths in the U.S. Cholera, the CDC said they helped prevent 7,000 cholera deaths after the 2010 earthquake in Haiti. Measles. The measles vaccine has saved 13.8 million lives from 2000 to 2012. And H7N9 influenza A, the new flu-like Middle East respiratory syndrome, MERS, and other emergency threats to human health keep coming, and the CDC must be ready. So why do I mention that? Because some of these, the flu, tuberculosis, measles, Middle East respiratory syndrome, all of those can be contaminated from skin to skin, and some airborne. So we just have to be careful into everyday activities that we mind ourselves with protecting our safety. So I thought this was a pretty neat slide. It shows that for Ebola, what the CDC has stated. So we've had 4 patients in the United States that were diagnosed. Yes, and 11 patients with Ebola were treated in the ES. So since that, they have trained hundreds of thousands of other healthcare workers to be able to readily respond. And a lot of that includes PPE training. So why did they do all this training? Because with the flights coming in, it's likely that this disease could show up anywhere in the U.S. at any given time. So having people trained is the key. So let's quickly go over some of the several types of PPE. One, let's talk with respirators. They serve to protect the user from breathing in contaminants in the air, thus preserving the health of one's respiratory tract. So this is for your airborne illnesses that we know of. Also, you have skin protection. This is stuff that we generally use every day. Examples of that is lab coats, face shields, gloves, clothing, and etc. Eye protection. You have goggles, face shields, shatterproof glass, hearing protection. Also, although that's not commonly used in EMS. Slides, protective clothing and ensembles. So this is the high visibility traffic vest that we all wear when we get on wrecks. Ballistic vest, some EMS uses this. A lot of the LEO, law enforcement officers, use it. And also the firefighters for their turnout gear. So let's talk about what donning and doffing of PPE is. So we're going to go over a Class B suit, which is going to cover you from most illnesses. It's not a fully encapsulated suit with an SCBA. It is a Millennium mask, which has a filtration system on, so it filters the air coming in. So let's first talk what donning and doffing mean. Donning is putting on gear and doffing is taking the gear off. I'm sure we all know how to put on general PPE like gloves and face masks. So today we're going to go over putting on and off a Class B suit. We will begin by going step by step. Then I will demonstrate how this is done. So for fun, let's just give it a little scenario. You are being dispatched to a sick person that started not feeling well several days ago. Her symptoms include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, and abdominal/stomach pain. So while you're en route to the call, you're reading the notes on your MDT, and you're about to arrive on scene when the dispatcher tells you that the patient just stated she recently arrived home from Africa after working with the sick people. So, does this change your thinking? Well, she could just be experiencing the flu, and then again, it could be the dreaded Ebola. So you're smart and decide that you should fully dress out to protect yourself. So the process begins, and also please remember to notify the hospitals early so they can prepare for the incoming patient as well. So we're going to go over putting on first your Tyvek suit. So you are going to take this yellow suit is generally what we have. Sometimes you can get the white ones. They're a little bit thinner. The yellow ones are heavy plastic. This is what I'll be demonstrating with later. You're going to place your legs into the suit. You're going to pull the suit up, placing arms into the sleeves. You're going to pull booties on, and you're going to tape your booties where the booties and the suit meet. You're going to zip the zipper and or fasten the Velcro, whichever your suit has. And then you're going to take Kim tape. This is a special tape. It is very sticky and it is resistant to most chemicals. Today when I demonstrate this though, I'm going to be using duct tape because it's a lot cheaper. The Kim tape's fairly expensive. So anyway, you're going to tape using Kim tape. You're going to tape the suit starting at the bottom of the zipper and running it to the top of the collar. You're going to place your Millennium mask on your face. You're going to ensure a proper seal. Place the Tyvek hood over the head, and then again you're going to use the Kim tape and you're going to tape the entire hood at the mask, marrying the hood and the mask together. To put on the gloves, you're going to extend the first layer to cover the wrist of the isolation suit and tape at the wrist where the gloves and the suit meet. Then pull a second set of gloves over the first layer and tape at the wrist where the suit and the gloves meet. So once you and your partner are fully dressed, you can now access your patient. If possible, let's consider using an isopod if it's available to you. This will help to ensure the contaminants stay contained. So the isopod has a filtration system with air going in and air coming out. You can see the filters on the isopod there. The yellow here is where you can run in IV tubing, O2 tubing, or anything like that you might need to access and treat your patient. The green holes on the side, they're actually gloves that are taped or fitted into the isopod so that you can access your patient from their feet all the way to their head, and you can see everything that's going on with them. So this lets you to treat your patient in a well-confined area where they're not going to be able to contaminate anyone else. So you have now gotten to the hospital and you've transferred patient care. But we want to get out of this suit because about 30-40 minutes in this suit and you're going to get quite hot really quick. So we are going to doff. Doffing meaning taking off the suit. You're going to start by wiping the outer gloves with bleach wipes. Wipe the entire outer suit with bleach. And then you're going to have your buddy or your partner wipe down the posterior, your backside of the suit with bleach wipes, and you're going to wait 3 minutes. Within 3 minutes, the bleach is known to kill the Ebola virus. Remove the tape and the outer gloves and place them in a waste container. Again, you're going to wipe your inner gloves with bleach. You're going to remove the tape from the zipper, wrist, hood, or mask and booties. And then you can go ahead and unzip your Tyvek suit and wipe your inner gloves with bleach. Have your partner or your buddy roll your suit inside out, starting at the hood and then working down the posterior of the back, removing arms from the suit. First layer of gloves will be removed with the suit because they're going to be taped to it. Remove one leg at a time, stepping away from the suit. And once you get the Tyvek suit off, you are going to place it in a waste container. You are going to wipe your inner gloves with bleach. You're going to remove your goggles, your face shield, and you're going to place that in a waste container. You're going to remove your first layer of gloves and place them in a waste container. Wash your hands with bleach. And then remove your Millennium mask and place that in a waste container. So, with all this being said, please be sure to consider wearing the appropriate PPE. Take the time to utilize your resources. It could mean life or death. Thank you, and I will continue on in a second with a demonstration of how to don and doff PPE.